This is David Schwab coming to you today on behalf of Glidewell's Inclusive Magazine. The topic is Demographics, Destiny, and Dentistry. You know, we live in interesting times. We are the first generation in the history of the world who can reasonably expect to live to be old. Life expectancy today in the United States is about 77.5 years, but this is a recent phenomenon. If you go back in history, if you go back to the year 1215, that's when King John signed the Magna Carta. At that time, life expectancy was only about 33 years. So how did it get to 77.5? Well, it took a long time. If we go back closer in history, just about 100 years ago, back to the year 1900, the dawn of the 20th century, life expectancy in the United States at that time was only 49 years. So we've gone from 49 years to about 77 and a half years just in the space of the last 100 years here in the United States. This increased life expectancy has tremendous effects and tremendous potential for the dental profession going forward. And here are some of the things that we're looking at to have happen. First of all, you know that the older folks, the elderly population, those over 65 folks, have increased dental need. We know that a population of young people has lower dental need, a population of older people has higher dental need, and the older population is exploding. Every day in America, 10,000 people turn age 65. The next thing is we are very familiar with what's called the perio-medical interface. And you know what's interesting? The older folks get it. They understand sort of a holistic view. They understand that oral health is part of general health, and that when they go to the dentist, it's not just about teeth. And they are very interested in quality of life issues. So that's going to be pushing folks into dental offices more so than in years past. Next, we also know that because of the recession, the number of dental visits has gone down because all patients, including the older patients, have been somewhat more reluctant about visiting the dentist and spending the money due to the economic climate. Well, what happens when patients put off dental visits? Periodontal disease is progressive, so some of these patients who have been putting off dental visits, even as the population expands and even as their own needs grow, what's going to happen is this great pent-up demand for dentistry is going to continue to grow. Eventually, the dam will burst, and the elderly will flood into dental offices. The last thing I wanted to mention is that when you look at this population of older people and you look at what's happened to them economically, this is not a good thing, but it's reality. And the reality is that folks have decided in some cases to keep working past age 65. They can't afford to retire. Their 401ks have gone down, so they're continuing to work. Now, the Social Security laws can be very complicated, but suffice it to say that some people can continue to work past age 65 and collect their Social Security check. So here we have an increasing population with increasing dental needs. People have been putting off their dental treatment, and now at age 65, they're still working because they have to work, but they're getting a government check every month, which helps them pay for some of the things that they need, like the dental treatment they've been putting off. So here we have an interesting confluence of events. We have a fast-growing elderly population. We have people who understand the connection between oral health and general health. We have people who've been putting off needed dental treatment even as their needs increase. And we have people who reach age 65, keep working, but also collect a Social Security check, which helps them pay for some needed treatment. Harry Truman once said that he wanted to hire a one-armed economist so that person couldn't say on the one hand this and on the other hand that. You know, the economists will continue to argue among themselves. And people ask me, would you rather have a great economy or would you rather have great demographics? It's not even close. The economy will cycle, it will go up and down, but demographics are destiny. The demographers have laid out the future for the next 20 or 30 years, and it does not get any better than this. This is David Schwab coming to you for Glidewell's Inclusive Magazine.